From CareCredit, it's Care Experts, a podcast where we dive deep into the health and wellness industry with the professionals that make it happen. I'm Erin Treloar. Today, I'm joined by Dr. Elise Min, a board-certified plastic surgeon who specializes in breast and body contouring. She's going to walk us through what's new in breast augmentation, the different options out there, how to make sure results feel natural and right for you, and we'll also touch on the growing interest in implant removal. Let's get into it. Dr. Min, welcome to the podcast.
Thank you so much. I'm excited to be here today.
We are going to talk all things breast augmentation, breast lifts, revisions, and removals today. Let's start off with breast augmentations. Can you tell me a little bit about the different types of breast augmentation?
So, great question. For breast augmentation, there are sort of different types. Theoretically, there are different ways to augment our volume. So the common way we think of is using breast implants. And another way is also using our own tissue, in which case we can augment with fat transfer. So fat from another part of the body where we don't want it, instead of throwing it away, we're recycling it to areas we want it.
And for the implants, are there different types of implants that we can get?
Yes. So there are different types of implants in so many different categories. So I don't want to bore you, but there are definitely different brands of implants. And then there are different types of implants. So they're all silicone shells, but it can be filled with silicone gel or it can be filled with saline sterile water. And beyond that, we're also looking at different volumes, different sizes of implants. And with it, we also could have women of different body shapes and chest width coming in. And let's say they all want 300 cc volume. It has to fit naturally and look good in each dimension of the chest. So that's where profiles of the implants are introduced. And people may have heard of terms like high profile, moderate profile, low profile. It's so that no matter what body shape you have, if you wanted a certain volume, there are different implants that can fit the chest for that individual.
I feel like recently it was trending where all of these celebrities and women started sharing their exact implants and their sizes and the type that they had, whether they had it under the muscle or over the muscle. What did you think of this trend?
I mean, being a plastic surgeon, when people are transparent, to me, that feels like somebody's like truly confident. There's that self-confidence in that transparency. And I respect it, and I think it's great. Not to mention people who don't want to share it, that's okay too. It's totally up to the individual. But celebrities are at a place where they can influence a lot of women in positive ways. So being transparent and giving them sort of, this is what I went through, really empowers a lot of people that they may not realize how many people are touched by that transparency.
How do you help somebody determine which type of augmentation or implant is right for them?
Great. It starts with asking them, so what are you looking for? What look are you going for? And I would examine their sort of natural anatomy, and that would help me kind of decide what would be good for the patient. I would do dimension checks here of base width of the breast so that I can better counsel them. And some patients who are prepared also come with photos of women who've had breast implants that they like the look of. So sometimes that says a lot more than these, oh, I want to be a D cup from a current B cup. That is a subjective measurement. And I explain to my patients, your B cup may be different from sort of what I'm thinking of as a B cup. And photos really say a whole lot more than just words. So after that has taken place, then we would go on to trying on different sizers. There are sizers in plastic surgery offices. They're not actual implants. They fit between a bra and the breast to sort of mimic what an implant would look and close. So based on kind of how it feels, the heaviness of it, the look, what they like, then they will tell me, okay, I'm kind of liking some of these sizes. And then I would do a 3-dimensional simulation. So the patient's actual body pops up in this 3D image, and then I'm able to put in different brand, different implant profiles and volume to see what it would look like on the individual, and we can actually model that in clinic.
Wow, such a fun way to use technology to be able to get that visual to ensure that the patient is going to be happy with the results at the end.
Yes.
You mentioned there's two different types of implants. What's the difference between those two, and how would you decide which one to use?
Yeah, so there are implants that are saline implants and
Mhm.
silicone implants. I would say majority of patients now use silicone implants.
Okay.
There was a period in the 1990s where we only could get saline implants at the time. So those patients who really haven't had issues and they're like, I'm here to get them exchanged. It never caused me any problems. I'll just maintain the saline.
Mm.
But a lot of patients like the feel of the silicone implants more than the saline implants. It feels a little bit more like natural tissue. Saline implants, some patients will say it feels a bit like a water balloon. And those, sometimes when they're running, they can feel the whooshiness of the
Mm.
water. So it's pretty easy after you feel it of why they would want the silicone implant.
Are there any trends that you're seeing right now when women are choosing the size that they want, or you mentioned that more women are choosing silicone, but anything that you're seeing in regards to the general direction that we're going with breasts?
Yeah, I would say the natural look,
Mhm.
more sort of people coming in. I want to look good, but I don't want people to know that I had plastic surgery good.
Mm.
So that natural look is definitely popular now. And in terms of more surgical technique, there are ways of placing the implant in the body. We have our pectoralis muscle, that's our chest muscle, where we can either put the implant under the muscle or over the muscle. So, in the last 5 years or so, there's also a little bit more of a change in plastic surgeons and patients sort of preferring to have it above the muscle as well.
What is the benefit of having it above the muscle versus under the muscle?
Yeah, so above the muscle, the benefit is that when you put it there, patients who sometimes when they get it under the muscle, a small percentage of patients may have what's called animation. So
Mhm.
that's when you sort of squeeze your pec muscle.
Mhm.
And these are situations when you're coming out of a pool or when you're working out doing weights. There may be a little bit of a sort of wrinkle that you can see on the chest
Yes.
when you're exerting the pec muscle. That's called animation, and that can happen when implants are placed underneath the muscle. And plastic surgeons will generally release the lower attachments of the pec muscle so the
Mhm.
implants sit naturally. And when that happens, it can lead to that animation. And if you have the implants placed above the muscle, that sort of low risk is not there.
Originally, why did they start placing the implants under the muscle?
Plastic surgery is one of those things that the pendulum sort of swings
Yeah.
one way or the other. So recent sort of history, we used to put it under the muscle, but even before that, we actually put it above the muscle too.
Okay.
So it just kind of varies on what's sort of new and what people want. At least the way we put it above the muscle now is called a subfascial placement. So that means we're actually placing it above the muscle, but underneath the fascial covering of the muscle.
Mm,
And previously, when we used to do it above the muscle, we meant sort of above the muscle, above the fascia of the muscle as well.
right. Okay. If somebody is worried about sort of the placement of their breasts,
hmm
they could consider a lift. Can you tell us a little bit about a breast lift? And are they often done with augmentations?
Yeah. So very much depends on the person. A breast lift is done when somebody has excess skin.
Mhm.
So a lot of the times people come in for a breast lift because now their breasts are sitting a lot lower than where they used to be on the torso. So they want it to be sitting higher and they want it to be sitting a little bit perkier.
Mhm.
That's what a breast lift will do. Now, breast lift will not give that extra fullness on the top portion of the breast. That is a lot more easily achieved by putting an implant in.
Mhm.
So, a breast augmentation where we're using implants, it's purely for volume increase, whereas breast lift is really shaping the outside skin and tightening that to make it look perky and sitting higher.
I see. I've heard of individuals having a breast augmentation or a
hmm
lift. It seems as though there are different ways to place it, like different spaces that you can be opening the skin to insert the implants. Can you tell us a little bit about those different procedures?
Yeah, that's a great question. And there's a little bit of variability depending on each surgeon's preference.
Hmm.
So, a breast augmentation alone is just putting the implants in. So, we don't need a whole lot of distance, a whole lot of incision length. So, in those situations, we can put it around the right at the fold level, or it could be around the areola, or it could be even transaxillary. So those are ways we can put implants in easily. Now, if we're doing a breast lift, now we have sort of the luxury of we got so much more access into the breast tissue. So in those cases, we would use our breast lift incisions and tissue that's now been sort of opened up, where we can put the implant in a lot easier with a larger incision that's all going to be closed up through the lift.
You mentioned earlier that there is a third option for augmentation, which is doing a fat transfer. This seems almost like it could be ideal in that you're using tissue from another part of your body or fat from another part of your body. What are the benefits of a fat transfer versus an implant?
Yeah, so fat transfer is for patients who, first of all, they need to have fat. So
Step one.
we need donor sites. But a lot of women have areas where fat go to. It could be the abdomen, it could be the thighs, it could be the hips. So if patients have extra fat there, then I can liposuction that and I can essentially harvest the fat from there and put it in our breast so that we have a little more volume. So it's really great for patients. Some people just don't like the idea of having foreign body in them. So it's for people who have certain preferences, and it's also for people who want just a modest increase. So let's say somebody who's like, I'm a B cup, but I just want a little to be a fuller B, but I don't want to be a C cup. If for those patients I put the smallest implant in, it's still going to be a full C or a small D. So there is no such thing as a half a cup improvement with an implant of any kind. So those are patients where like fat transfer would be the perfect surgery.
Gotcha. Amazing. Let's talk a little bit about the actual surgery, the day of the big event. How long are people typically in surgery for?
Yeah, so for breast augmentation alone, that's probably one of the shortest plastic surgery operations out there. So augmentation alone can last, I would say, sort of an hour, hour and a half for most surgeons. Now, the actual experience of being at the surgery center is a bit like checking into the airport for a flight. There's checking in and checking out, picking up luggage. But whenever you're flying, you're always kind of like, oh, that's a lot shorter than I thought.
Yeah.
So the surgery itself is probably, I would say, could be even less than an hour to an hour or an hour and a half.
Amazing. And I imagine that varies depending on whether they're doing an augmentation or a lift or...
It's for augmentation only.
Okay.
If we're doing a lift at the same time, it will add more time. So that will be, we're looking at more sort of 2 to 4 hours, depending on what sort of lift they're doing and what sort of needs there are in that anatomy.
What does recovery look like for this surgery?
Breast operations, patients are always very much surprised that, oh, this is honestly not that bad. So it's no heavy lifting beyond 10 pounds. That's about a gallon of milk for about 4 weeks. But in terms of your ability to just go about the house and engage with your family members and your friends that you live with, you can start doing that the evening of surgery, especially for breast augmentation. Whenever I call my patients the evening of the operation, they're very much like, you don't sound like somebody who had surgery or feel drowsy at all. And some patients are already sort of out and about shopping the next day.
Wow.
So it is pretty remarkable as to how low of a downtime it is.
Does it take the implants a minute to settle into the body? What are we looking at as far as really getting those optimal results?
Yeah, so implants will definitely need time to settle. So this is something I would counsel my patients. It generally takes about 3 to 6 months for it to fully settle. Right after the surgery, about a week after, people will always find that, oh my gosh, implants are up by my neck, and that's going to improve. And even between the 1 week appointment to 2 week appointment, patients recognize, oh wow, in 1 week I see what you mean by settling. So in that first month, there's a lot of settling that happens. About, I would say, 60 to 70% of settling happens during that time. And then the rest of the 30% will happen between month 1 through month 6.
When somebody's considering breast augmentation or a lift, is there anything that you're looking for in order to determine if they're a good candidate for it?
Yeah, great question. First would be just making sure they are healthy, that they are a good candidate to undergo anesthesia and a good candidate who can heal from surgery. Now, second component would be just making sure, are they at a point in their life where this is a good time to undergo the procedure? So that's important depending on people who now have maybe little children to take care of, or they're in a bit of sort of busy time of life,
Yes.
whether it's because of work or family commitments. Those are all things I would sort of consider, and making sure that they're not actively breastfeeding. That would be a contraindication. Those are what I'm thinking.
Amazing. I think that the woman's body is so fascinating in that it goes through some really major changes 3 pivotal times in life: puberty initially, then if a woman is to decide to have children, pregnancies, and then again in menopause. What are your thoughts on doing an augmentation or a lift during these times? Like, how long after puberty should a girl wait before considering a breast augmentation? And then again, after pregnancy, do you need to wait a certain amount of time after breastfeeding, and so on and so forth?
Yeah. So in terms of the puberty part of things,
Yeah.
it's actually made easy because there are rules that will tell us with saline implants, 18 is the cutoff. And then for silicone implants, it's 21. Now, if we're talking about reconstructive reasons as to
Yes.
why we're putting in implants, it doesn't quite have an age criteria. But for aesthetic breast augmentation, there are sort of limits as to what we are supposed to use as a guide.
Gotcha.
In terms of later on, if you've had pregnancy, that phase, as soon as somebody's in a good state of health, sort of both physically and mentally, and feeling like they are done with breastfeeding and their milk has dried up, that's a good time to pursue. And then for menopause, also same thing. If they're in a good place, both physically and mentally, it's a good time to pursue as well.
Do implants have any impact on breastfeeding? If somebody's put implants in earlier before getting pregnant, does it have any impact?
Great question. For implants alone, if they didn't get a breast lift at the same time, breast augmentation really does not cut any milk ducts in the process.
Okay. But if they've had a lift, then it could be something that would impact?
It could.
Yeah.
And also depends on sort of what level of breast lift. There are different techniques surgically that can be done. It can be super minimally invasive and more maximally invasive.
Yeah.
So you can imagine more cutting of the tissue would risk more cutting of the milk ducts. So generally that can reduce the risk of breastfeeding a little bit, but even patients who are undergoing breast reduction where chunks of breast are being removed, there's a certain amount of breast that has to stay behind where I as a surgeon would not cut any parts of that in order to maintain your nipple areolar complex to be alive and still sensate. And with it, you have milk ducts that are completely untouched that are still able to breastfeed in the future. Same with breast lift. In this case, I'm essentially doing same sort of procedure as a reduction, but I'm not removing extra tissue. So there is that chunk of tissue that's keeping your nipple alive and sensate, and there are milk ducts in there that allows breastfeeding. So for breast lift alone, the chances of breastfeeding is still pretty high. I would say maybe like 70% would be a reasonable number.
Gotcha. I am hearing more and more, or seeing more and more women removing their implants. What are some of the reasons that women are removing implants?
You're absolutely right. There are a lot of people coming to get their implants removed. It depends on each person. I would say there are some who are coming in because they're just kind of done. They're like, I wanted it in my 20s, 30s, or whenever I wanted it, that I wanted that little self-confidence boost. And now my body has changed. I've gained a little bit of weight and I don't need that extra weight in there. Some people may have some of the side effects of breast implants. I have capsular contracture. That's when the scar around the implant has thickened and now you have a little bit of an unnatural looking bulge that sits a little too high while the rest of the tissue has sort of fallen over it. Those are patients who are also not interested in implants anymore. I don't want to have to think about getting any sort of revisions down the road.
I have some amazing questions from our audience for our Ask Me Anything segment of the show. The first question: if I gain or lose weight after surgery, will it change how my implants look?
If you gain weight, the implant can sort of get buried in the tissue. It almost looks like, do you have implants?
Yes.
If you lose weight, the risk is now the tissue overlying the implant may sort of lose that it slides off the implant. So if it's a significant amount of weight changes, whether it's loss or a gain, it can impact how it looks. But in terms of like 5 pound, maybe even up to 10 pounds, it wouldn't lead to a significant drastic changes as I described.
So if somebody's considering going on a GLP-1, would you recommend that they do that first, see how their body reacts, and then consider an augmentation after?
There are some patients who are going on GLP-1s for sort of, I just want that last persistent 5 pound off. Those are patients where I would sort of feel that it really wouldn't matter when you get it done, but you do want to be off of GLP-1 for at least 2 weeks before surgery to reduce risks of procedures.
I've heard you have to replace implants every 10 years. Is that actually true?
Yes, that is true.
Okay. My natural breasts are a bit wide set. Can implants bring them closer together, or will they always follow my natural spacing?
Great question. I actually do answer that quite a bit during my consultations. So depending on which plane we put the implant makes a difference. So if you put it underneath the muscle, then you're right, there's not a whole lot we can do because our pectoralis muscle that inserts to sort of the sides of our sternal bone determines what the extent of your cleavage would be. Now in those patients, if we want to help it out a little bit, we have fat transfer and other little ways of making it better. But patients who are born with sort of wide attachments of the pec muscle and they would end up having a wide cleavage, but they want a narrower cleavage, that's a population where it would be a good idea to put implants above the muscle. And then the surgeon can cheat a little bit of putting it beyond where that muscle would usually attach. Because we're not limited by those muscle attachments, and that can minimize the gap one would have as a cleavage distance.
Amazing. Any tips to help with scars after surgery?
Yes, scars. There are things we can do at the time of the surgery and things we do after. And commonly we think of silicone-based products. So there are silicone scar creams, there are silicone tapes, and scar healing generally takes up to a full year. So for most patients, it's important to stay out of direct sun exposure during that time frame, and it's important to put some sunscreen on those areas if you are in sun exposure situation.
Amazing. Thank you so much for joining us on the podcast. It was a pleasure to have you here.
Thank you.
Hey there, don't leave yet. Just wanted to say, if you want to hear more about health and wellness, check out these episodes of Care Experts. Also, before you go, make sure you like and subscribe. New episodes drop every Wednesday.